Hello, everyone. Thank you so much for continuing to watch the videos that we are producing, introducing you to some of the fantastic people who are supporting 1128 and our work with women in ministry. Among those really fantastic people is Dr. Jennifer Shewmaker, who is a professor at Abilene Christian University. We're really grateful for her time and the session that she is going to be participating in, along with Zena Regis and Amy Bose-Tinniger, regarding our inner life and how the pandemic has impacted our spiritual and mental and emotional health. And so I'm thankful for her expertise and thank you for your time. I'm really glad you're here.
Thank you. I'm glad to be here.
So I asked this question of everybody that's been on the videos is, first of all, tell us a little about who you are and what you do, and then tell us a little bit about, from your seat, from your perspective, what have you noticed about the pandemic and the challenges that it has brought and will continue to bring?
Well, so I'm Jennifer Shewmaker. As you said, I'm a psychology professor and the Dean of the College of Education and Human Services at Abilene Christian University. And so I've had a unique seat for that reason, being an administrator in a school and getting to see faculty and staff who are dealing with the pandemic as teachers and as staff working in a school, and then also with students. I'm also the mother of 3 daughters. 2 are college students and 1 is a high school student. So I've had that unique perspective of a parent watching students at different age levels kind of go through the pandemic. And it's been interesting to see the challenges that my daughters have faced, as one, a senior in college getting ready to graduate and go forward, one a sophomore in college, kind of in the middle of her college experience, and then a junior in high school, and all of the different pieces that the pandemic has sort of messed up for them. And then again, like I said, watching and supporting faculty and staff as they work with students through this situation.
That's great. Thank you. When I asked the question and kind of invited you to this conversation, I'm Enneagram 3, which means I'm by nature an optimist, and I'm always looking about 6 months down the road. So we titled this the post-pandemic soul as a way to engage folks in the conversation. But of course, the pandemic is still going on, and the post-pandemic is a few months away still. That being said, you are probably already beginning to see some of the challenges that we are not only facing now, but will face later as we begin to transition. Tell me what you see. What can we look forward to as things change into a new normal?
Yes. So this whole year, I've been talking with our faculty and staff and the leaders in our college about this idea of the new normal or the next normal. I think one thing we really need to know just and accept, as difficult as it might be for some of us, is that we're not going back to what was before. The world has changed and we have changed because of the pandemic. Our cultures and our communities have been altered in many ways through this struggle and the loss and the grief that we've dealt with both personally and corporately. And so I think there's got to be a level of acceptance that there is a new normal or a next normal coming. And we need to look towards that. And so that's kind of the first thing I would say is we need to get to a place where we say it's going to be different. I don't know exactly what that means, but it's going to be different. One thing that I notice now, and I think that we're going to have to deal with in the next several months, is this idea of there was an article recently about languishing. And that was the term that was being used to describe that kind of blah, stuck feeling that a lot of us have right now. I don't know about the rest of you, but I've been struggling with, and as I talk with others, I think this is a pretty normal experience with these feelings of something just doesn't feel right. And you keep trying to fix it, especially if you're a person who is used to being able to make things happen and to help things happen with your action. And so the languishing comes in when we've kind of started to realize that we can't do a lot about this situation. I mean, we can wear our mask, we can practice safety, we can, care for those in our community the best we can. So there are things we can do, but in many ways, I think a lot of us have felt helpless. And we've been in this place now where we're kind of accepting, okay, I couldn't change that situation. And that doesn't feel good to a lot of us, especially, like I said, people who tend to be action oriented and helpers, people who like to help, who feel like they don't know how to do that right now. So I think we can expect to feel some of that languishing, to feel some of that frustration, and that stuckness is kind of what I'm calling it. I think that will change. So if we give ourselves some time to move, like you said, to true post pandemic, then we'll be able to start doing more. And even now, in some of our states and countries, we know that we're starting to be able to do more than we could before. So that leads to some hopefulness. I think we're starting to see a peak of that hopefulness of, okay, maybe, I mean, this has been a very long, not just year, over a year that many of us have been just feeling really stuck and unable to do the things we wanted to do. So I think now we're starting to kind of see the light at the end of the tunnel a bit. It's out there, and so I think that hopefulness is on the horizon for a lot of people too.
So I love the word languishing.
Yeah.
It's a really great word. And how we've kind of all been in limbo, this liminal
Mhm.
space for a year plus now.
Mhm.
Um, I I wonder, and I'd love to hear you talk more about this as we think about the next normal, and that there
Mhm.
is a sense of hope.
Mhm.
It can be easy to get in a hurry to get there,
Mm.
to pretend like it's already here.
Yeah.
And can you take a moment to talk about the psychology of being still and
Mm.
being patient? Uh, Both what that will do for us
Yeah.
and what that may do to us in this moment.
Yes. So I think from an emotional perspective and psychological perspective, waiting, there's that book, Oh, the Places You'll Go. And Dr. Seuss talks about when you're in the waiting place. And most of us as adults go, oh no, yes, we've been in the waiting place. And it's not a fun place to be. But there's something very growth producing about those waiting times. And one of the things that I always try to do myself and encourage others to do when you're in that waiting place, which as a world, it feels like that's where we are at the moment, is to make sure that you're practicing some, I would say, spiritual disciplines and physical disciplines as well. So, doing things like, and emotional disciplines. So, doing things like using contemplative practices of journaling, of if you like doing meditation, prayer, those kinds of contemplative moments, they give you the chance to acknowledge the waiting and acknowledge the feelings that you have around the waiting. Some of us may feel excited because we think there's something good around the corner. Some of us may feel angry because we don't have control over the amount of time we'll be waiting. Some of us may feel sad because we're stuck somewhere. Maybe we lost our job and we can't work. And so we're having to wait until the economy opens back up again. And then some people maybe feeling hopeless. Maybe they have had COVID and they're still dealing with symptoms of COVID, or a loved one did and they've lost them. There's so many different uh, things that we might be feeling as we wait for that next normal to come. And like I said, I think those practices, those contemplative practices of prayer, of journaling, of meditating, of walking, that's where I bring in that physical discipline piece. I think walking, any kind of physical exercise that you can establish in your routine that helps you be mindful. So, walking, yoga, those kinds of things, I think will really help center you and give you a place to feel like you have a little bit of control. That's kind of the key to those practices. The disciplines is that I have something I can do, something I can control. And whether that's when I do my Bible study every day or when I go for a walk every day, or how my prayer life looks, that's something. And that's a good thing to hold on to from an emotional perspective when you're in that waiting time.
That's beautiful. Thank you. That waiting space from Dr. Seuss, the waiting room. I like that. It's a wonderful story. It's a good reminder. I I like the idea of the rituals you described.
Hmm.
Whether that's the going out and the walking, being active, or being still and taking a moment
Hmm.
to journal or pray. All of these things are good rituals.
Hmm.
I notice, and I'd love to hear you talk about it a little more too. I notice that there are certain rituals, if you will, that we had before the pandemic,
Hmm.
that maybe we haven't been able to continue, good or bad, as we've been in the pandemic. So now, as we eventually and hopefully soon emerge from the pandemic, what rituals do we need to, or do we have the opportunity maybe to
Hmm.
begin to incorporate that we didn't have before?
Wow. What I think of most right now when I think about those rituals that many of us had in place in our lives that have just been absent, is community and gathering in community. Most of us have been involved in trying to do that over technology. So I think there's something about that that's been helpful and comforting to still be able to connect, but there's a piece of the practice of being with one another physically that we just haven't been able to do. And I think thinking about how do I was actually thinking about this just the other day. For those who tend to be more introverted and sort of are kind of like, oh, I'm kind of comfortable in this. I don't see anybody and I don't talk to anyone. But also, I think those folks are probably starting to notice some loneliness setting in, even those people who prefer to be on their own. So I think it's going to be really important for all of us to start figuring out, how do I incorporate some practices of community, some rituals around gathering, whether that's with a small group or it's outside. Many of us have had, the virtual coffee hour kind of thing with our friends to try to stay connected. um, it's just difficult, and I think it's really, really important. And for those of us who have felt that loss, I think if we and even if you haven't, I think you still need to think of ways to begin to be with one another again, in ways that you feel safe and feel that you can do in a healthy way. But that that ritual of connecting is something I took for granted. I think, I mean, now that I look back, I think I used to go to a Zumba class, and I would see those people every couple times a week, and I just took that for granted. I haven't seen any of those people for a year. And then church, every week you go, sometimes multiple times a week, and see these same people. And now you don't, especially if you've been doing online church where all you see is whoever's talking, and you don't see the community members who are also watching. And so those kind of connection rituals, I think, are going to be really, really important for us, all of us, as we move out of COVID and into our next normal.
I like that, the connection rituals and reestablishing those.
Hmm.
As you know, the fundraiser event is centered around the idea that women in ministry
Hmm.
too often have not had that community, or the
Yes.
community that they've had has been unhealthy, or where
Hmm.
they have been minimalized, marginalized, ignored, dismissed. And that those are trends and themes and stories that are all too common.
Hmm.
Um, and so, one of the reasons we really want to focus on this particular issue is exactly what you talked about, is that churches have too often had rituals of community which excluded rather
Hmm.
than included.
Yeah.
And so, I'd love to hear you speak for a moment about what might happen
Mm.
if churches discovered this opportunity to say, oh, we need to listen as a way of inviting women into full community, full participation, full
Mhm.
representation in what a church is about.
Yeah. It's interesting. I've been thinking and talking with folks in Christian higher education a lot over the past couple of months about the idea of diversity, equity, and inclusion. And for me, the key kind of concept that wraps all of those together is that of belonging. And I believe that when we can get to a place in our hearts where we see, individually and as a community, when we see everyone as created in God's image and God's beloved, called to use their gifts to serve and love the world, it really opens up our perspective and it changes from, well, you can't do this or you can do this, to what's God calling you to do? How has God gifted you? And what passions has God put on your heart to serve? And how do I then help support that? I mean, one of the fun things about being in higher education is I get the opportunity to work with fantastic faculty and staff who really love the work they do, and with students who are coming in and discovering their vocation. And my job is just, how do I help you do more of the things you're called to do? I think churches need to be in that exact same frame of mind. I think they need to look at their members, and especially those who have been marginalized in the past, like women, people of color, perhaps in churches that are predominantly white, and say, how do I look at you with God's eyes? And then how do I open up doors of opportunity for you to love and serve the world in the way God's calling you to do? And I think if we can get in that frame of mind, it just changes everything. It helps us um, step away from these cultural rules that we've put on people and think about, what is God asking of that person and how do we facilitate that? And my goodness, the opportunities, if we can take that perspective, are world changing, because these folks, I always think this is funny. Why would we not want 100% of the members of our body to be able to serve to the utmost? And because this world needs all of us. This world is hurting, especially right now. This world is just in deep need of God's love and our service to them. And we all need to be out there doing that in the best way that we can. And so I think a church just has incredible opportunities to love and serve our neighbors in new and different ways when we open up those opportunities to everybody who's a part of the body.
Beautifully said. Thank you, Dr. Shoemaker. I really appreciate that you're going to be part of this event and sharing your wisdom and experience alongside Zena and Amy. What a great opportunity for everyone. If you're watching this video and you've heard a lot about what Dr. Shoemaker has to say, I want to encourage you to come to that and hear more of this conversation, which will be dynamic. And I just can't wait. It's going to be really great to see the three of y'all talking together.
Yeah, I'm looking forward to it.
Excellent. Very good. Well, thanks so much again for joining us, Dr. Shoemaker, and I look forward to seeing you again on May 11th Noon is when the event starts, and of course, your portion of the event will start at 1 o'clock. So I look forward to seeing you then.
Great. Thank you, Trey.